Endometrial cancer, the silent danger hiding in your uterine lining. Hi, I'm Dr. Lily from GinSen London, a traditional Chinese medicine clinic with over 20 years of experience supporting women's health, including menstrual irregularity, fibroid, endometriosis, and today's topic is endometrial cancer. In our last video, we talked about why implantation can fail even when your hormones are balanced or IVF goes smoothly. But today, we are going one step further. What if that same line, the one meant to nourish life, started growing abnormally, uncontrollably? Today, we are taking that step, understanding how imbalance in the uterine can go beyond the fertility challenge and develop into something much more serious like endometrial cancer. From a traditional Chinese medicine perspective, we will explore the early signs, root patterns, and the natural way to support your health long before a diagnosis even appears. What is endometrial cancer? Endometrial cancer is a cancer of the inner lining of the uterus. What we call the endometrial is lining that build up and shed every month during menstruation. But when this process become abnormal, for example, the lining keeps build up without shedding properly or start growing in an unusual way, and over time abnormal cells may develop. In TCM, we do not view this as a random occurrence. We see it as a result of prolonged internal imbalance, often involved stagnation, heat, and toxic accumulation within the uterus. Number 2 is early symptoms, TCM warning sign. In Western medicine, the key red flags are vagina bleeding after menopause, spotting between cycles in premenopause women, pelvic pain, cramping, fatigue, and anemia due to chronic blood loss, difficult getting pregnant, recurrent miscarriage. But those symptoms doesn't arise from nowhere. According to Chinese medicine, your body often whispers long before it shouts. Some early warning signs may include irregular, heavy, or prolonged menstrual bleeding, cramping that warm over time, bleeding between periods, usually discharge, lower abdominal pain, or sense of heaviness, feeling hot, irritable, or flash sign of internal excessive heat. If you notice this, especially if you are over 40 or have risk factors, don't ignore them. These signals are not random. They are asking for attention. So number 3, who is most at risk? Most cases happen after menopause, usually in women over 40, but younger women can also be affected, especially if they have irregular cycle, PCOS, or obesity. This is what both women and Chinese medicine agree are major risk factors. Obesity. Excess fat tissues generated unopposed is estrogen, which overstimulated uterine lining. Hormone imbalance, especially estrogen dominance with lower progesterone, insulin resistance, PCOS, irregular ovulation, and unregulated hormones. Family history, especially with genetic syndromes like Lynch syndrome. From a Chinese medicine lens, these factors translate into patterns such as damp heat into uterus, often from long-term greasy, sweaty, or raw food intake, poor metabolism, or unresolved infection. Qi and blood stagnation, poor circulation created stuck energy and tissues overgrowth, phlegm accumulation, particularly in those with chronic digestion, weakness, and fluid retention, kidney deficiency with toxic accumulation in older women, or those with chronic depression. The body's ability to regulate the growth and eliminate the abnormal cells diminish. Number 4, how TCM sees endometrial cancer carry, not just tumor. Rather than focus only on remove the tumor, Chinese medicine asks what kind of internal healing allowed this glow to form. Simply say is what is the root of cause. In our experience and GinSen, the most common pattern linked with endometrial cancer include liver qi stagnation, heat, blood stasis, emotion stress that is held in the body builds heat which dying and sickness blood leading to messes. Spring qi deficiency with damp phlegm, weak digestion lead to internal mucus and fluid buildup, make it hard for body to clear abnormal cells. Kidney yin deficiency with empty heat. As women ages or undergoing long-term stress, these reserves of yin decline. This created false heat or evil heat that damage the tissue from within. Number 5. How TCM approaches endometrial cancer. Chinese medicine doesn't treat cancer that way Western oncology does, but it offers powerful complementary support, especially in early stages or recover phase. Diagnosis through pattern differentiation. Tongue and pulse diagnosis help determine which organs and symptoms are imbalanced. Even before cancer develops, the percent of chronic blood stasis, phlegm, dampness, or toxic heat buildup signs risk. Herbal treatment. Tailored herbal formula may be include 牡丹皮、赤芍、桃仁 to clear the blood stasis, 栀子、黄芩 to purge heat and inflammation, 薏仁、茯苓 to drain dampness, dissolve knots, 白花蛇舌草、半枝莲 traditional used to support detoxification and immune response in tumor setting. These herbals are not a cure on their own, but in an experienced hand, they can become powerful allies in your recovery. Acupuncture, moxibustion, diet, and a gentle movement like Qigong you can watch via TikTok channel or play a key role in restore internal balance. Please WhatsApp us for more details. Maybe we can make a tailored this exercise program for your condition. Number 6. What if you have already been diagnosed cancer? So in many early stages case, Western treatment offer an excellent progress, but the Chinese medicine can alongside to support you rebuild strength and vitality, especially spleen and kidney, calming fear and emotion stagnation through acupuncture and herbal formulas. Whether you are nearly diagnosed or just worried about risk, our team at GinSen is here to support you with personalized insight, not just generically advice. Book a free email consultation or you want with one-to-one video consultation. Discuss your case in deeply level. We will walk you through your unique body pattern and support planning. If today's topic felt heavy, that is easy, but it's also help because you have second option, because you have natural care. The body often gives us signs years in advance. If you missed our last video, I highly recommend it to go back to watch. Inconsistent, those two stories are deeply connected. At GinSen, we believe prevention beginning with understanding your body signal, not just after diagnosis, but long before. No matter where you are in your journey, prevention, recovery, or simply concern, our TCM expert is ready to guide you with clarified and care. I'm Dr. Lily from GinSen, Nature, Women's Health, Infertility, rooted in traditional, guide you by insight.